today's video, we'll discuss about angina pectoris. So, the definition goes as it is a clinical syndrome of episodic chest discomfort resulting in resulting from transient myocardial cardio ischemia. Now, the pathogenesis. First of all, what happens is there is an intramural plaque. Now, this plaque starts to build up. Okay, it bulks up or it builds up, and it causes the narrowing of the coronary artery. So, due to the narrowing of the coronary artery, there is ischemia, and then there is the organs are not being supplied well, so there is pain. Okay, now coming on to the underlying cause. To remember the underlying cause, I would like you to remember an acronym AOC. If you forget to remember this, suppose basically we are discussing about angina, right? So think of the Democratic Party Congresswoman Alexandria Ocasio-Cortez. So Alexandria Ocasio-Cortez. Okay. Now coming on back onto angina. A for angina, A for Alexandria Ocasio-Cortez. Remember it like this. Now the underlying cause, right? A stands for aortic valvular disease. O stands for obstructive hypertrophic cardiomyopathy. And C stands for coronary atherosclerosis. Sclerosis. Now coming on to the clinical features. For clinical features, we'll draw a man. Okay. Oh, sorry. Yeah. So as I told you before, there is going to be pain. So what is the characteristic feature is that the pain occurs in left shoulder, then left arm, then scapula, and then lower jaw. Now it is of 1 to 5 minutes, and it is crescendo discrescendo in nature. Then we have fever, anxiety, dizziness, weakness, shortness of breath, chest pain, also pain in stomach area. Important feature here, there is sweating. Yeah, sweating. So precipitating factors, they include physical exertion, some drugs, lying flat, emotional disturbance, cold exposure, heavy meals. Even there is a thing called as nocturnal angina. It usually occurs due to vivid dreams in the patient. Okay, this completes the precipitating factors. Now moving on to the physical examination. For physical examination, usually it is negative, but however, first of all, you look for precipitating factors, also risk factors. Then we will see that in the there will be signs of left ventricular failure, like you will see basal crackles, cardiomegaly, third heart sound, then murmur of papillary muscle dysfunction. Also, you can see signs of atherosclerosis, which are bruits on carotid vessels, xanthoma. Now, coming on to the investigation. In investigation, first of all and foremost is ECG. Now, in ECG, there are two types: resting and exercise. Now what will happen is we will see that there will be flattening of T waves, and there will be depression of STT. Okay, now if the STT wave is depressed more than 1 millimeter below the baseline, and it lasts for around 0.08 seconds, so it is positive stress test. Okay, it is used to confirm the diagnosis. Now another is echocardiography. In echocardiography, we will come to know that whether it is heart failure, aortic stenosis, or it is hypertension. Now another is isotope scanning. In this we use thallium isotope scanning. Now what happens is, in this we use IV thallium 201. Then others are CT, MRI, PET scanning, also coronary angiography. Now, in this, we have a radio opaque dye which we insert, and we see the course of the dye, and through it we come to know the underlying cause and the site where there is obstruction. Also, this is done prior to angioplasty or cardiac bypass surgery. Now, coming on to the differential diagnosis, what else can we see? Where else can we see the pain, all the manifestations? Now, musculoskeletal in myalgia and costochondritis. Okay, you can remember the systems as MNC GRP. Suppose there is an MNC which is named as group, MNC group. Okay, so by N neurological, we have hepatic neuralgia. Then C, with C I have with C I have um, with C I have CVS, so acute aortic dissection. Then by G, GIT, so hiatus hernia or reflux esophagitis. Then we have R, by R we have respiratory pleurisy because there's chest pain, right? And pneumothorax. Then by P, we have psychological because we are seeing fear, anxiety, depression. So cardiac neurosis. Okay. Now coming on to the treatment or the management part. So first of all, in management, our objectives. What are our main objectives? Objectives is to identify and control risk factors, to assess the severity of disease, to control symptoms, to improve life expectancy. Okay, now first one, risk factors reduction. So, risk factors to be done and not to be done. So, not to be done, first, smoking, alcohol, undue physical exertion or strenuous exercise, heavy meals, undue exposure to cold weather. Okay, now coming on to be done. First of all, maintain an ideal body weight. This is very important. Then there should be exercise, to 20 minutes 3 times a week. Now, if suppose the person is doing physical exertion, okay, so like it is very intense physical exertion, so they need to take sublingual nitrate before they do that, they do the activity. Then change in lifestyle, healthy lifestyle should be adopted. Then coming on to the estimation of the existing illness, that is severity. We will see it by the underlying causes like anemia, hypertension, or thyrotoxicosis. Okay, then coming on to to control the symptoms, I mentioned all the drugs before in the coronary artery disease. The same will be here too. Now coming on to an important thing, which is surgical treatment. Now in surgical treatment, we have two modalities. One is coronary angioplasty, and the another one is coronary artery bypass grafting. Now this also is called as percutaneous transluminal coronary angioplasty, P3CA. Okay, in this what happens is, we take a balloon and we dilate it, and we pass it through the guide wire, and then we inflate it. Okay, now what is the indication? The indications are either there should be complete, or we need to do partial revascularization in stable angina, unstable angina, myocardial infarction, or it is a palliative measure for recurrent angina. For recurrent angina, also if there is acute coronary syndrome. Now coming on to coronary artery bypass surgery. Over here, a number of veins can be used, vessels can be used, but most commonly used one is saphenous vein or internal mammary artery. Now, indications is left main coronary artery stenosis, or it can be triple vessel. In triple vessel, remember left ascending, left anterior descending coronary artery, then left circumflex, then right coronary artery. Post operatively, you need to give aspirin 75 to 150 milligram daily to improve the graft patency potency, sorry. So yes,